Hello, my name is Dr. Dewan S. Raja. Today I will discuss about liver biopsy. What is liver biopsy? Why we do it? Hepatic tissue or liver tissue is obtained by liver biopsy for diagnostic purpose. How it is done? Liver biopsy is done through the right 9th or 10th intercostal space in the mid-axillary line. This is the percutaneous type of liver biopsy. Under normal circumstances, no other structure lies between the right and the anterolateral surface of the liver and the diaphragm. Patient is asked to hold his or her breath in full expiration to reduce the costodiaphragmatic rhesus and to decrease the possibility of damaging the lung and the contaminating the pleural cavity. Okay, so patient when in full expiration, lung goes up to the level of the rib number 7. When lung is full inspiration, it may go to the level of the rib number 9, maybe 8. Okay, so it is always done when patient in full expiration and hold the expiration. Okay, so types of liver biopsy will give emphasis today on percutaneous liver biopsy. Other liver biopsy like transjugular liver biopsy or laparoscopic liver biopsy, another type. Our percutaneous liver biopsy may be blind percutaneous liver biopsy just by the physician's assessment by percussion on the right hypochondriac region, or it may be guided by the CT scan or by the ultrasonographic techniques. Okay, so here we'll go to the indications for liver biopsy. There are many indications for liver biopsy. Cirrhosis of liver. Okay, there is excessive fibrous tissue formation and the architecture of the liver is lost, hepatocytes are lost. Hepatitis, different type of hepatitis that is diagnosed by liver biopsy. Drug reaction, because all the drugs are metabolized, most of the drugs are metabolized in the liver. Granuloma, chronic inflammatory mass, it may be due to amoebic liver abscess, a complication of amoebic liver abscess, or maybe any other chronic inflammatory disease like tuberculosis. Okay, we may have chronic inflammatory mass, that is the granuloma. Tumor may be primary liver cancer or tumor or benign tumor, or maybe malignant cancer, or maybe metastatic cancer to the liver. Unexplained hepatomegaly, enlargement of the liver when it is not understandable without biopsy. Unexplained jaundice, persistent increase in liver enzymes, Wilson disease, that is a copper deposition disease. There will be cirrhosis of liver and there will be Kaiser-Fleischer ring around the eye, around the limbus. There is a junction between the cornea and the sclera at the peripheral part of the cornea. There will be Kaiser-Fleischer ring. There will be damage to the basal ganglia like putamen globus pallidus in Wilson disease, okay, due to lack of an enzyme called ceruloplasmin. So in that condition, liver biopsy is also an indication. Sarcoidosis, amyloidosis, that is something is depositing, amyloid deposition in the liver. So how it is done? It is done by a 14 to 18 gauge needle. This is the diaphragm. This part is the costodiaphragmatic recess. We'll try to go below that in the intercostal space between the rib, maybe between the 9 and 10, maybe from 10 to 11 rib. These two rib. Percutaneous liver biopsy requires the patient's cooperation. That is very important. Patient must be able to lie quietly and hold his or her breath after exhaling the air. That is at the peak of the expiration. Okay, that is done. Okay, this picture has been taken from Mosby's Manual of Diagnostic and Laboratory Test, 6th edition, Pagana and Pagana. I will put the link in the description of my video. So if you are interested, you may look at that link and you may collect this book if you like. Okay. So contraindications of liver biopsy, non-cooperative patient, because it is always done under local anesthesia and there may be some discomfort. Patient should tolerate that discomfort at least to the minimum level. Patients with impaired hemostasis, there may be huge hemorrhage may happen due to impaired hemostasis, lack of platelet. There may be some problem in the blood clotting factors. Okay. Patients with severe anemia, then liver biopsy is a contraindication. There will be more chance of bleeding, more loss of blood. Infected patient, like in the right pleural space, there may be infection in the right pleural space, okay, or in the right hypochondriac region of the abdomen. There may be some infection, a spread of infection in that patient. Liver biopsy is contraindicated. Obstructive jaundice, there is too pressure buildup, too much pressure in the liver, too much portal hypertension in obstructive jaundice. That is also a contraindication for liver biopsy. Hemangioma is a very vascular tumor. Okay, if it is penetrated, then there will be huge bleeding may occur. So in a patient with hemangioma in that particular area of the right hypochondriac region or lower rib of the chest wall overlying the diaphragmatic dome, so there is any hemangioma in that place, then it should be avoided. So liver biopsy is contraindicated in that type of vascular tumor. Ascites, collection of fluid in the abdomen. Okay, there may be contamination due to excessive fluid in the abdomen, that is ascites. Okay, so that is also a contraindication for liver biopsy. Potential complication of liver biopsy, hemorrhage at the site of penetration of the needle. Pneumothorax, there may be air entry into the interpleural space. So the needle may be displaced or mal-directed. That may cause this problem. Air may enter into the pleural cavity and that will cause the lung to be collapsed. Chemical or hemorrhagic peritonitis, that may also happen. Okay, that is also a complication of the liver biopsy. Okay, and that's all about the liver biopsy. If you have any question, please feel free to ask me. And these are the references. I will put the Amazon link in my description part of the video. If you are interested, you may collect this book or you may go through this book in the library. So have a nice day. Please share the information with your friends. Please support my channel. Please subscribe me. Bye now.